My name is Jake Gedden, and I'm one of the founders of Seidr Software, Inc. I'm really excited to introduce you to Seidr Software, our one-of-a-kind clinical decision support platform that was designed to really pioneer precision mental health care as it's seen in other healthcare aspects. When we open up this page, this is kind of what a clinician would first view at looking at our homepage. You'll get to see our patient registry that will have their patient caseload available to them. The first thing that I'd like to highlight is the score that is right in the middle of this screen, where this allows us to be able to prioritize and reduce wait lists when it comes to patient populations. Too often, most mental health care is based on first come, first serve, unless someone is experiencing an acute mental health crisis. That's how they can kind of be bumped to the top of the list. We've designed a triage score based on 10 different evidence-based tools that provide us scores 0 to 30. This allows organizations to be able to intervene early, reducing overall healthcare costs from maybe costly trips to the emergency department due to a mental health crisis. And our risk score, we have it color-coded by green, all the way to red to symbolize acuity. Orange, you want to get someone in as soon as possible. Red, you want to get someone in immediately to be able to intervene. Also on this page, you can see our ability to track patient progress due to 3 of the most common outcome-based screening tools, specifically the PHQ-9 for depression, the WHO-5 for overall well-being, and the G87 for anxiety. This allows organizations to track and see how patients are responding to care, whether if it's moving in, it'll be red if it's moving in a negative direction, yellow if it's staying the same, but green if it's moving or trending in a positive direction. This also allows for early intervention and proactive support for patient populations. Our software is HIPAA compliant. Our data is secure, both at rest and in transit. It is also protected through a 2-step authenticator system to add an additional layer of security. When you click on a patient, you're able to get into their chart essentially in the clinical decision support system. This will give you some background information. Also, you get access into the forms. This is where you get to see how the assessment tools present across different populations. By looking at this overview of these scores, you can see what they screen for, like the name of the form, the criterion, as well as what they screen for. They'll either highlight it based on a similar color coding system from green to red, or like not highlighted if it doesn't meet criterion. One of the really cool things about this feature is this can be copied and pasted right into a progress note in an electronic health record system or in other data keeping systems. You can also scroll down and look at forms individually as well. One cool feature about this is the cascading features. On certain screening tools, if the initial screening tool is positive, it will automatically cascade into another tool to confirm. For example, the MDQ, a tool designed to screen for mania, if that is positive, it will automatically cascade into the ASRM or the Altman Mania Scale, will either confirm or not confirm a positive score. That also happens with the AQ10, which will automatically cascade into the AQ50 to screen for autism, as well as the ASRS-5, where it will automatically cascade into the ASRS to confirm a positive ADHD score. And if you scroll down, you can see like what the scores look like individually. You can go through each of the forms. What's really cool is we actually provided a info tab that if you click on it, it provides more guidance on what to do, what to send next. We've also developed background forms that are really unique to us. We have history forms that clinicians are able to gain really relevant information before the patient ever walks through the door by looking at maybe things for development to look for potential neurodevelopmental conditions or delays. Environmental stressors, this could include substance use or alcohol use in utero. We get a detailed family history of mental health conditions across various family members. We also have developed a wonderful medication history where we nearly have most mental health medications, both generic and brand name, broken up by generic and brand name as well as by category. You can scroll through this and see what medications were taken prior to the patient coming in, or if you need to update it. We're also able to screen for trauma, where the patients can do this in the safety of their own home. We also look for wellness. This would be like basic needs kind of concerns. This whole report can be saved as a PDF and attached to a progress note, or you can copy and paste the entire report or individual forms, or save individual forms, either attach them to a progress note or copy and paste them right into a progress note. Another really cool feature is our qualitative diagnostics section. This allows for clinicians to kind of go line by line down DSM criteria, phrased in the form of a question that will elicit like how symptoms will manifest in a patient's life. Based on, we have an algorithm, and so based on the scores of each individual scoring tools, certain things will be highlighted red, guiding the clinician to explore these a little further, not necessarily to diagnose, but just to rule them out to ensure best practice care is being provided. This qualitative piece is one thing that really sets Seidr Software apart from other clinical decision support systems, where you have the screening tools, but this integration of the qualitative aspect kind of takes this software and designs it to be like a mixed methods research study where you're blending quantitative and qualitative data to try and get as close as humanly possible to an accurate diagnosis. Another really important feature that I like to share is Seidr's ability to share patient information across multiple organizations. One of my biggest frustration as a mental health clinician and a clinician working in integrated behavioral health care was the inability to track patient progress when collaborating or working with different organizations or different agencies. One feature that I'm really proud of here is Seidr's ability to share both the assessment tools and qualitative information, even active links in the evaluation process with other organizations. So in the share feature, you just hit share, select your organization. BHCS is where we initially piloted Seidr. Select that organization, select by clinician, I'll accept myself, and send. I will get a notification that a different organization shared a client with me that we're both working with. Of course, any organization that is using this feature, we strongly encourage to utilize a BAA to allow that free flow of information exchange. When you're working with another organization, the ability to share not only their current forms that we demonstrated in the last video, but also send information to a patient. If I just wanted to send a checkup, where that's the PHQ-9, GAD, WHO5, I can just hit this button. We've also developed a feature where you can include common screening tools if you're working with neurodiverse populations. That includes the ASRS-5, which screens for ADHD, the AQ-10, which screens for autism, and the TOS-20, which screens for alexithymia, which is common in both of those conditions. Hit this, hit next. You will see that you can either send an email, text, or copy and paste the link into your EHR messaging platform and send it to patients, making it that easy. As they hit send, you go to the active links section. It will show what's available, if the patient has done this or not. Once the patient does complete the forms, it will auto-populate into this form section, allowing you to track progress. It also auto-populate into the checkup section, which will allow you to see how they're progressing across those 3 common assessment tools, as well as a graphing function that will allow clinicians to be able to monitor progress by score and date, to be able to provide a better understanding of what specific life events or treatment interventions were leading to the changes in these scores. Another feature that makes this very unique is our enhanced reporting feature. So this feature allows organizations to track patient outcomes across all of our screening tools that are available. This is something that's really important to me as a person. Again, we always struggle to get accurate reporting with mental health outcomes, especially things like the PHQ-9 or GAD or even the audit for alcohol use, which we include here in Seidr. But in Seidr Software, through this platform, you're able to run a report based on your patient population. This might take a minute to do, but you'll be able to see our demo patient population, which has all their assessment tools. You can easily download a CSV file, run it through a statistical analysis software. The CSVs are automatically de-identified when it comes to patient population. You can do the same thing for tracking PHQ-9s, WHO5s, or GAD7s, really allowing for efficient patient tracking. We do have an option to download CSV files of all the qualitative examples from the assessment process. With this feature, Seidr is really primed to be able to integrate with AI or machine learning platforms to make incredible discoveries on how assessment tool trends will look across the patient population and how these assessment tool trends can correlate and interact with the qualitative data. When a patient gets the screening tools, they'll click on the link that was sent to them, they'll plug in, this web page will open, and they'll plug in this user password, which is usually a number combination, hit start, and they'll begin going through their forms. So I'll just kind of go through these real quick, but or if you try it, I'll try and submit one. Too late. But this will go to the next screening tool, and we can just hit several of these tools. And if I do this one and I try and save, it won't let me save because it needs me to click on the addition buttons to finish the form. It moves on to the next one where we are just go down. Let's kind of get these, just click random buttons. See what happens. Move on to the next one. Kind of go all the way down on this one to try and kind of get through it to show you guys what it does. This has more questions, but we'll just go all the way down and see what happens on the demo patient. Then we'll go over to the other screen. You hit submit. It says thank you for answering this question. And then if we switch over here to the other screen, go to my patient's forms, you're going to see the forms are going to show up right in, there we go, on go by date. Then if you go into the checkup function, after you'll be able to look at the various changes in the scores, you'll be able to see any sort of movement. This will also update the graphing function down below as well once a patient completes these forms. This is how a patient utilizes Seidr, how the clinician can easily track, quantify their assessment tool scores as soon as the patient completes them. So Seidr is one of the best things I've ever done. I really encourage you to consider adding this platform to your organization. I think it could really change the lives of those you serve.